Hi, I'm Dr. Will Ross, Associate Dean for Diversity and a Professor of Medicine here in our Nephrology Division at Washington University School of Medicine. I wanted to talk to you about the COVID-19 vaccine. I truly understand some of the concerns that a lot of us have had about this vaccine. I mean, is it safe? Is it effective? I've had those concerns given to me by my own family members, as well as staff in our hospital. And so I've had to really talk through what's going on. Why was this vaccine produced so quickly? And indeed, is it safe? First, I understand the distrust, particularly in the African American community and the Native American community and in other communities that are under resourced. Those reasons are there, and we clearly get that. I also understand that this vaccine was really developed with the goal of making us healthier. We know the statistics, and they really are not favorable to our community. African Americans and Latinos are twice as likely to develop COVID, and 3 times more likely to die from COVID. So it really is important that we get behind this. So again, the health of our community really is important. So it's really just a reasonable approach to getting this vaccine to the community as quickly as possible. Now, is this vaccine safe? I mean, that's what I hear a lot, and because it was basically produced in record time, and there are some people concerned that maybe corners were cut in the production. Well, we were really fortunate for lots of reasons. Some good top-notch scientists got together nationally, particularly here in the United States, and they benefited from having access to the genetic sequence of this virus earlier than expected. So they were able to produce this product based on the active part of this virus that allowed it to enter into the cells. They were able to identify that active particle, active particle, and develop this vaccine in record time, because they also had federal support for funding. Academic medical centers like Washington University, pharmaceutical companies received financial support so they could actually focus their time and energy on this, not at the expense of their other activities that would make them less productive. So that's why they were able to get through all the trials, the phase 1, the 2, and the phase 3 trials in record time with good approaches to including the African American, Latino, and other communities of color. In the Pfizer and Moderna trial, about 30% of the trial participants were of color. So that's really good news. So when this vaccine came out, it really was a safe and effective vaccine. And as a frontline worker, I was there to get this vaccine when they called me. I had the first dose and had just a little sore arm, and then the second dose had a touch of a headache. A really mild headache. I took 500 milligrams of Tylenol, and it was gone in 4 hours. And that was 2 weeks ago. I feel great. I want us all to feel great, but I also want us all to really feel good about getting themselves healthy and getting our community healthy. This is the way we're going to get through this. So I urge you to really think about what you can do to make our community healthy and move forward getting the vaccine. Thanks.